Today, we'll be informing you about a cardiovascular disease, the stroke, brought to you by Matthew, Brandon, and Belle. Strokes cause almost 1 out of 19 deaths in the United States every year and is a leading cause for long-term disability in the United States. The stroke, a cardiovascular disease, is caused by a vessel in the brain being blocked by blood clots or ruptures in the veins. These blood clots and vein ruptures lead to the blood carrying less oxygen to the brain cells, which the brain cells need to function. There are three main types of stroke: ischemic, hemorrhagic, and transient ischemic attacks, or TIA. Ischemic strokes are the most common type, taking up 87% of all cases that are caused by a large plaque or cholesterol buildup in blood vessels. Hemorrhagic strokes make up 13%. These types of strokes are caused by a rupture or a puncture of blood vessels in the brain. Lastly, transient ischemic attacks are mini strokes that only last for a couple of minutes, caused by a smaller buildup of plaque or cholesterol. TIA strokes can be warnings of future ischemic strokes. It is important to see a doctor immediately if you ever experience a TIA. And to lessen the number of deaths due to strokes, the BFAST acronym was developed by Intermountain Healthcare, standing for Balance, Eyes, Face, Arm, Speech, and Time. This is a simple way to quickly assist a person that seems to be having a stroke, and if they have one or more of these symptoms, call 911.
TPA, or tissue plasminogen activator, is a drug designed to treat strokes, specifically ischemic strokes. It is given to patients through an IV in the arm. Once administered, TPA quickly dissolves blood clots that block important blood flow to the brain. If TPA is applied within 2 to 3 hours after the stroke emergence, it will greatly aid in restoring blood flow to afflicted regions of the brain, thus limiting damage.
Much like with any other treatments or medicines, the usage of TPA is strictly regulated. It can be only used in cases of ischemic strokes, which can be identified via a head MRI. People who suffer from conditions like brain aneurysms, head injuries, blood clotting issues, high blood pressure, or bleeding ulcers cannot undergo TPA. Similarly, people who are pregnant or have recently undergone surgery may also not undergo TPA because it is a blood thinner. The blood being able to flow well throughout pregnancy and clotting post-surgery is vital to a speedy recovery and minimal complications. TPA has proven to greatly improve the conditions of stroke victims, but the treatment is not without serious risks. Although uncommon, TPA can cause hemorrhaging in the digestive system and the brain, which may cause headaches, weakness, stomach pains, and although unlikely, seizures.
Despite the possible risks, it is still absolutely recommended for one to seek treatment for a stroke, as inaction may be more devastating. In order to ensure the best results from TPA, it is important for everyone to learn the signs of stroke onset in order to assist the people around them. Just remember, don't hesitate and be fast.